Hi, my name's Lee Matthews and I'm a physiotherapist and I work here in the pain management team at Queen's Hospital. Today I wanted to guide you through some stretches that you can do if you've been experiencing low back pain. When we have problems with our low back, often things like pain can interfere with how we go about doing tasks, and sometimes you might stop doing certain things altogether. What we know though is if you introduce some gentle stretches and go about that in a gentle manner that doesn't irritate things too much, over time we can actually help to improve things like joint stiffness, things like muscle tightness, and on a bad day, by doing some gentle stretching, it can even help to reduce muscle spasms so that flare-ups pass quicker. If you're interested in finding a little bit more about why we start to introduce movement and exercise with pain conditions, if you click on the link above, it will take you to a video called A Rehabilitative Approach to Managing Your Pain. So today I'm going to guide you through 8 stretches that you can do sat in a chair. Some of them there'll be the option of doing them in standing as well. And with each of these stretches, I'm aiming to do 2 of each of them, holding for about 10 seconds. You work at a comfortable pace at home, and it might be with some of these things you even notice pops and creaks. I don't even mind if you experience some temporary discomfort with doing the stretches, as long as it doesn't last for the rest of the day. So find yourself a seat and we'll get started. So for all of my stretches today, I'm going to be using a nice firm back chair, definitely a chair without any wheels on it. Before we even start the stretching, remember to sit in a nice upright posture. If you sit with a slouch when you're doing your stretches, you're more likely to irritate your symptoms and you'll actually get less out of the stretch as well. So a good starting position is always important. And remember to relax into any stretch that you're doing. So before we even begin, let's have a little wriggle around from side to side. Let's do a little bit of rolling back and forwards and bring yourself forwards in the chair so you've got a little gap behind you there to allow some movement. The first movement we're going to do is one called rotation. So take one of your hands and pop it over the outside of the opposite knee. The other hand that's not on that knee, hold onto the side of the chair. Let's sit up nice and tall, and what we're now going to do is twist around from the shoulders over towards that side. And we're going to hold and relax into that stretch for about 10 seconds. And then back to the start position. And let's do the same to the opposite side. So again, take one hand over the opposite knee and then continue to move those shoulders towards that knee. So we're twisting around and relax. Remember to breathe. And you might find that as you hold that stretch, you can slowly do a little bit more movement. And relax. So we'll go back to the first one we did. Again, take your hand over the opposite knee, holding to the side of the chair. We sit up nice and tall and we're going to move around. And what I'm actually going to do now is put a little bit more pressure on the outside of that knee, and that's actually going to help increase the intensity of the stretch. So if you found it a challenge, just stick with the gentler version, but if you found it's easy, you might actually add a little stretch there with pushing on the outside of your knee. And one last time to the opposite side. So again, hand on the outside of the knee, sit up nice and tall, twisting around towards that knee with your shoulders, and just again, I'm going to add a little bit of pressure on. I'm just going to hold and sustain that stretch there. So that's a movement we call rotation. Our next stretch is a movement called side flexion or side bending. So we're going to aim to reach down towards the side of the chair there. You can do this in standing as an alternative. So again, if you're not near a chair and if you're up and about, you can still have a stretch, but just doing the same thing in standing. So sit up nice and tall and pick the side. You might go towards a good side to begin with. And again, sliding that hand down towards the floor. And you're going to feel a really big stretch in your side with this one. And again, relax into the stretch. Hold for about 10 seconds. And then back up to the start position. So let's repeat that over to the other side again. Here we go. And it's normal to find that one side's got more movement than the other. So again, just work with what feels comfortable to begin with. And back up to the start position. And again, over to that first side we did. And we'll hold that. Relax into it. and then back up again, and one last time over to the other side. That's good. Our next stretch that we're going to do is an alternate knee hug exercise. So I'm going to be bringing my knee up towards my tummy. If you've had a hip replacement, you're going to find that your movement's less on that side. So don't go forcing it too far if it feels a bit irritable there. Work with what's good for you. And again, if you've got a grumbly knee, it might be that you support underneath the thigh. But if you're feeling okay with it, you could even hold on the front of the shin there to give an extra stretch. So work with what's comfortable for you. But I want you to pick one of your legs and either holding underneath the thigh or in front of the shin, hug it in towards you, hold in again for about 10 seconds. And then again, whatever you've done on one side, let's do the same on the opposite side. So again, either underneath the thigh or in front of the knee, hugging them in towards you. And then relax again. So ideally 2 on each side. You can do this in laying as well. If you found it was uncomfortable and seated, you do it when you're laying flat on the bed. And then the same on the other side. That's great. So for our next movement, it's a pelvic tilt. And we're going to show you a progression to that as well. So the easier version, I've got my bottom away from the back of the chair, and I'm sat sideways onto you so you can see what I'm doing. I'm going to move into a slouch with my low back area. So here we go. I start up nice and tall, and I go into a slouch. So I'm rocking on my sitting bones there, and then I'm going to come back up into that mid position, and then I'm going to go into a sergeant major position. So I'm going to stick my chest out, arch my back, and then again, going back into that slouch, and then back up nice and tall like a sergeant major, and then relax. If you found that was easy, the progression to it would be to curl up like you're curling into a ball. So again, I really stretch, and that's a stretch for your entire spine really, isn't it? It's all the way from your tailbone all the way up to the neck. And then again, really poking that chest out, really arching the back as far as you can the other way. So you work with what's right for you, work with how your symptoms allow movement to occur, and hopefully you won't irritate yourself and get the benefit out of that stretch as well there. Our next movement we're going to do builds on that movement into a full movement of flexion. So again, this time I'm going to slide my hands down the front of my shins towards the floor. And if you're really stiff or tight with this movement, you might only go a very short distance, and that's absolutely fine. If you find that the restriction is your tummy, then you can make a bit more space by bringing your legs slightly further apart. So again, work with what's right for you. And the aim would be to just slide those hands down the front of your shins towards the floor, and then slowly back up again. And we do that one more time. Here we go. And back up to the start position again. Well, while we're in this position, I'm also going to do a stretch for the back of the thigh. The muscle called the hamstrings can get tight sometimes. So again, it's really important to have your bottom forwards on the chair for this one, so you've got some room for manoeuvring. And with one of your legs, I want to straighten it out in front of you, and you can have the knee nice and straight on that leg, the other leg going to stay in the start position. The easier version of the stretch would be with the toes pointing away from you, but to increase the tension in the stretch, you can have the feet pointing up to the ceiling. So what I'm going to do to stretch the hamstrings, I'm going to stay up nice and tall and bow forwards from the hips. And hopefully as you do that movement, you're going to feel a stretch on the back of the thigh there. So I hold that for about 10 seconds, and then back to the start position, and we'll do the same on the other side. So bringing that leg out and away from you, and again either with the toes pointing away from you or up to the ceiling, and I'm going to bow forwards and hold and sustain that stretch there. And whatever you've done on one side, I then want you to repeat on the other side again. So here we go, bring that leg out in front of you, toes in front of you, up to the ceiling, whatever works best, and we bow forwards. And again, you should feel a stretch there. It's very common if you've got things like sciatica to find one side's a lot tighter than the other, and that's completely normal. And again, you just work within what your abilities are. And then one last time to the other side. Now, we've stretched the muscle called the hamstrings. I also want to stretch the muscle on the front of the thigh called the hip flexors and the quadriceps. The way I'm going to go about doing that, I'm going to have myself sat towards the front of the chair, and this time I'm sat sideways onto the chair. So I'm holding firmly onto the back of the chair there, so I'm nice and stable. The leg I'm going to stretch, I've actually got my bottom cheek hanging over the edge of the chair there. And you might even have a table in front of you so you can hold onto it for stability with the other hand. What I'm aiming to do is I'm going to slide that leg away from me until you start to feel a stretch on the front of your thigh. Now, if you found it's irritating your low back in this position, I want you to ease off the stretch and just make sure that you've got your bottom still tucked underneath you. What we don't want is you overarching from the back. So we keep our bottom in a nice position, maintaining a nice straight back there. And what we're going to do is feel that stretch hopefully on the front of your thigh there. Hold that for about 10 seconds, and then we do one more on that side as well. Here we go. So I scuff my foot along the floor, hold it for about 10 seconds, and then back to the start position. So let's turn around on the chair and do the same on the other side. So here we go. You hold on to the back of the chair there to be nice and secure. I'm going to start off with my bottom in a nice neutral position there with my back tucked underneath me with my bottom. And again, you can hold onto a table in front of you. If you're nice and secure, then that's fine. But I slide that foot underneath me until you start to feel a stretch on the front of your thigh there. So let's hold and maintain that stretch for about 10 seconds. And then back up again. And then one more time. Here we go. So do what you feel safe with. Safety's got to come first with all of these exercises. And again, you might even have a table in front of you that you can hold on to for some security there. Alternatively, you can do this exercise in standing by holding onto the ankle. It's a little bit more reliant on you having good balance, so I think doing it in a chair is probably a good start for most people. And for the last of our stretches, we're going to do a stretch for our calf muscle. And I'm going to do that in standing, leaning against a secure surface. So I'm going to hold onto this wall. You might even want to lean against a table or even your nice kitchen worktop maybe. So stand about an arm's length away from the wall, feet about hip width apart, and I want your feet to remain parallel from one another throughout this exercise. So it's a bit like your feet are on the rails of a train track. So I'm going to step the leg that I'm going to stretch out behind me. And it's really important that throughout this exercise that back heel remains on the ground. My back knee is going to remain straight, but to get the stretch, I'm going to bend my front knee, which is going to make my hips come slightly further forwards. And in doing so, you should feel a stretch on the back of your knee, perhaps even all the way down to the ankle. And we hold and maintain that for 10 seconds. And then back up again. And let's swap over and do the same on the other leg. So again, it might only be a small step that you do back behind you to feel a really big stretch. So go gentle to begin with, find what's comfortable. And again, my feet remain parallel, and notice that back heel remains flat on the floor throughout this stretch. That back knee is straight, but the front knee is the one that's bending to control that stretch. And again, back to that first leg again. And with all of these stretches today, hopefully you've noticed that I don't bounce, I just relax into each stretch. And you shouldn't be straining with these either. And then one more time on that other leg. There we go. So there's lots of other stretches you can do. There's lots of positions you can get to do these stretches. And it's about making them suitable for your circumstances. There we go, and you can relax. So that was 8 stretches that you can do that might well help with symptoms of low back pain. Always work at a pace that's right for you. You might notice pops, creaks. We don't even mind if you feel a twinge or some discomfort with these, as long as it doesn't cause a big flare-up that lasts you for the rest of the day. So work at a pace that feels right for you, make them fit your circumstances. And once you're comfortably doing these, you might actually start to notice some improvement, but it can take up to about 2 months to start to notice some of these things. So hang in there and go gentle. And once you're comfortable with those things, we'll often consider adding gentle strengthening exercise. It might be going for a walk, it might be other things. So start gentle, have a go at some of these stretches and see how you feel, and hopefully they'll be of benefit for you.